Today we're going to talk about IRB and your IRB application. I know for a lot of you it looks really daunting, and it is a lot of information, but a lot of it you've already written and you may not realize it. So that's one of the reasons why I wanted you to get the proposal done ahead of time so you can sort of cut and paste from what you've done already and have everything ready to go, and you just have to add it to the application. Although the application sometimes does not intuitive and doesn't necessarily connect directly in your mind from your research proposal, but it will. So one of the first things you want to make sure that you do is, and every IRB is different, so you have to read what your institution wants and how they want it and go by that. So you have to, check all the boxes and fill in everything. But I'm just going to give you an example and some of the concepts and ideas that they're asking for. I might use some examples from some of the projects that you all are doing. If I don't use your project, doesn't mean I don't remember it and I don't know it. It's just some are better examples than others. I'm also going to upload with what I'm saying, an example of a lay summary, which sort of covers some of the questions and issues that we have to do when we do places when I've done research, so you can see that as an example, not to cut and paste, but just an example of how it might look, the wording, those kinds of things. And again, you're doing an IRB application. They may ask you to change it later, clarify some issues for them, and that's fine. That it's an ongoing relationship. They're going to look over your research after a year or 6 months, depending on the constraints they put on you for a time frame, but that's all good because this is a partnership. And you're working with other people to make your research better and to make sure that you protect subjects and that you protect the school from liability and things that you may not think about. They've got lots of experience and they might think about, and they're there to help you. So it is a partnership. It is not an antagonistic relationship, trust me. One of the first things you want to do is you want to make sure that you look at the application checklist, and they're going to ask you to include things like your consent forms. Now, some of you are doing surveys, but you're still going to have that consent form. A consent form, by the way, should have 8th grade or lower type language. It should be very understandable. It shouldn't use sort of a lot of medical jargon that people wouldn't understand. It's got to tell people the risks and benefits of the study in a way that they can understand. It also has to include the phone number and name of someone they can contact if they have other questions. That could be your advisor and the head of the IRB, which is Dr. Zach. So please keep that in mind. Again, your application should tell you those kinds of things. If it's a verbal consent, then you still have to, or you're going to give it, you still have to say what specifically things that they are verbally consenting to. If you're doing online, there still has to be a consent. It may include saying, if you continue and do this survey, that is considered consent, but they still have to know what the research is about, how it's going to be used, and how their information is going to be taken, those kinds of things, and how their confidentiality or their identity is going to be protected. We'll talk a little bit more about that later. But that's something that you have to include, those consent forms, also those surveys. But again, we'll talk about it. One of the things that each IRB application asks for, and at some institutions like Mount Sinai where I do my research, or some of my research, it asks for a lay summary. But that lay summary is very much like most IRBs, which is I have to have a brief statement of the purpose of the study. And again, these are very short and concise, and it has to tell about the potential side effects, risks, or adverse impacts. Now, some of it could be there is no potential risk, but I have to explain why that is. Or it might be the risk of they're going to get bored doing this survey. Sometimes if the risk is they might get upset answering these questions, then I have to also provide a place where they can go if they get upset after they answer the survey because it brings up sensitive issues, those kinds of things. You do have to have that information available for your subjects, and it has to go to the IRB first so that they know you've done all of this and protected the subjects. We also have to talk about whether or not they're going to get compensation. So are you going to give them incentives? Are you going to give them, they're going to be enrolled in a drawing if they participate in this? What kind of things are they going to get? If they're not going to get anything, then you might say it's so that we can have a better understanding of whatever you're looking at. Patient education with diabetes, type 2 diabetes, or patient education and administering of drugs for adolescents. Those are knowledge that we can gain and will make it so that we can better serve our patients and have more impactful outcomes. Okay? Those are outcomes, but you need to let the people who are going to possibly participate in this study know that, and it has to be very straightforward in your application so that the IRB also knows that. One of the things too is, are you going to give them any compensation? You have to say what that is and whether or not that could be a form of incentive, enticement. So you have to be very careful about that. And again, that's where the IRB's breadth of knowledge can help you with those issues. One of the things you also have to look at is how are you going to get consent from them? Is it from a form? Are they going to sign it? Those kinds of things. You also have to talk about whether they are participating in it voluntary, and a statement has to say that in your consent form. It has to be able to know, they have to know if they take part in your study, are they going to be able to stop at any time? Do they have to complete it? Do they have to do your study so that they'll get what is considered standard treatment, or what you're doing is above and beyond, or will it not impact the treatment that they're getting? Because these are very issues embedded within anything to do with health and medical research. Is some patients or some participants might think that they're going to get access to healthcare they may not get otherwise, or they're going to get special treatment, and if they don't take part, that they're not going to get the treatment that everybody should get, whether they take part in the study or not. And I know that some of you, I've had to say, whatever your intervention is, it's going to be above and beyond what the standard treatment is. It's not going to be in lieu of. And you also have to make that very clear to patients or participants who might take part in the study. So that has to be included. And there are sections where you talk about this, okay? But that's the kind of thing that the IRB really needs to know, that you've made clear to your potential subjects in your consent letter, in your giving them information about the study, in how we're going to collect the data, in how the subjects are selected, okay? All of these things seem daunting, but you've already written about them and you've already gotten some feedback from me and from your advisors about this, and it is embedded in your research proposal. You just have to sort of find where we talk about it, okay? Another thing that you need to talk about is, once the participants decide to take part, how are we going to make sure that either they're anonymous or that their information is confidential? So are you going to do as we've done, where we will go and assign a number, not the patient's hospital ID number or patient number, but we will assign them a number, and we will take away identifying information so that no one that looks at the database or no one that looks at the surveys, if they're doing a survey, can trace it back to that patient. Now, one of the things we do is we assign them numbers, and then the name that goes with that number would then be kept in a locked file drawer in your advisor's office, so that it would be very difficult for other people to get access to it unless they also had consent, or unless they were the advisor or part of your study. So you need to be very, very clear about how you're going to protect your subject's identity and how we're not going to be able to trace that information back to them. Some of you are going to look at actual outcomes, as far as negative outcomes, whereas people prescribe medicine right or wrong, whereas people did interventions right or wrong. And one of the things you need to keep in mind is that information, for it to be truthful, forthcoming, we have to not trace it back to that individual. So someone's going to have to assign a number, and then we're going to have to separate that number from that name, and it's going to have to be kept somewhere in a locked file drawer. So again, these are what they're talking about with how is it going to be confidential, how is it going to be anonymous, and your job is to sort of prove how your study is going to do that. Also, one of the things that you need to talk about when you're doing your data collection, and that's going to be another part of your IRB, is they're going to ask, how are you going to get this information? Is it going to be a survey? Is it going to be secondhand data? Is it going to be electronic patient records? They need to know specifically what you're going to do, and then they're going to ask you, how are you going to do this, and how are you going to administer this survey? Is it going to be you personally administering it, or is it going to be part of what's standardly done as far as customer service, so to be administered whether you did this or not? You have to be very explicit on what you're doing and how you're doing it. That includes all the surveys that you include, even if you're doing sort of a standard, this is a customer service survey that we're going to look at outcomes after we do this intervention. You need to include a copy of that customer service, that section of that customer service survey. Again, that's something you may not think about, but you really, really do have to think this through and add it to the IRB application. So you sort of have to get a lot of secondary documents to put with this application for the IRB process to be reviewed. One of the things you need to talk about too is, where is this going to be done? Is it going to be in, one of the things we talk about is it going to be done in triage? Is it going to be done in a patient's room after they've seen the doctor? Is it going to be done while they're in the hospital? If so, when? Those kinds of things you also have to answer about when the data is going to be collected. Is it going to be recorded? Very difficult and not always a good idea, because that can be problematic. Where are you going to store the tapes? How are you going to take away the identity? So those are kinds of things you need to keep in mind before you say you're going to record stuff or not. One of the things too is, how are you going to identify your subject population? Are you going to advertise for them? How are you going to make sure that they're over a certain age so they can give consent? If you have younger people who are going to take part in your study, are you going to get their assent? And that also would have to be included with the consent. So you need 2 consent forms to be included with the IRB application. One of the things too is, if you're going to record people, what are you going to record them with? Is it going to be a video? Is it going to be audio? Is it going to be photographs? Again, you have to be very explicit of how you're going to do it and where that information will be stored, and make sure that it's a safe place so people cannot get access to it. And again, part of this is we can't trace the information back to that specific individual. Okay? And these are things that we, again, have talked about all along, about how we get our subjects, how we get information about what people do or don't do, where are we going to put that, how are we going to make sure that people are forthright so that we don't have issues of selection. All these kinds of issues we've talked about, and they're embedded in your research proposal, okay? You just might have to find them and sort of put them together. So those people who I said get a copy of the survey, you have to have a survey with that. Those people who I've said you must have a consent and an assent, that has to be there. How are you going to get information? If you're going to do some of this, some of you are going to do this in another institution, then you need to get a letter that the institution says that it's okay that you're doing this study. So you might sort of have to let the institution know what you're doing, which is always a good idea. And they also have to give sort of their consent that they will allow you to do it on their premises. This is especially true if you work there, because you actually will have access to more information about patients than a standard researcher coming from the outside would. And again, in medicine, we have HIPAA and we have the right to privacy. So they're very strict for good reason. One of the things too that you want to talk about is, how many subjects are you going to enroll and what's going to be their age range? Why are you enrolling them versus another? Now, we talked about this again with a research proposal when we talked about inclusion and exclusion criteria. So that's sort of where you'd pick that up and you'd add that to this IRB application. But again, look through each section and figure out where in your research proposal we've talked about this. And if we haven't explicitly talked about it, then let's think through what we're going to do with that information. How are we going to code it? How are we going to assign a number so we can trace it back to the patient? Where will that information be stored? Have you gotten consent and permission from the institution? Will you have a letter that says that you're allowed to go and do this from this date to that date? All of these things need to go with the IRB application. So some of you I've been pushing to talk to these places and make sure that you can get this information, and some of you sort of made changes in your research proposal based on that, which is all good and fine, but you need to include that with the IRB application. So again, look at your research proposals, see where that information is, fill out the IRB application as best you can, but I think you've sort of got more of a leg up than you think. You also have to put in you've already uploaded your certificates, your NIH certificates. Think about some of the issues that they've talked about to make sure that you don't have those issues. We'll go forth from there. It looks more daunting than it actually is. You've actually covered and done more than you think you have with relationship to this. So I'm going to include some examples in addition to this video. I hope it helps. If it doesn't, you can always reach out to me. But hopefully this sort of helps break the parts down and you can connect them back up to that research proposal and see that you've already sort of got a leg up and that you've got some stuff that you can add and you've got it and you can make it a full document and turn it in.